because some grandmother take over and the mothers don't have a chance to even hold the baby for themselves.
Everybody are expert in a raising baby.
And I had to say to the mother, but my God, I really would love a nutmeg to put in my porridge. And if you did not bore this one, I would have taken it home.
Anything what I have to do with dopey, I always tell people, me feel like whatever you believe is what will follow you. So because me not believe in it now
Which
will
is
follow
true.
me.
And even for the scrunchie and the arm, sometimes I have to take them. And I say, that if you really bless this baby, pray for them, they will be okay. Always pray for your children.
People believe that first of all, they should use a broom and sweep the baby foot to make them walk faster. Hi, mamas and friends. Welcome to another episode of the Memories and Motherhood podcast. I'm Whitney, your favorite baby photographer and host. This podcast is brought to you by Little Memories Photography, where little moments last a lifetime. From maternity to newborns, every milestone, we're here to help you capture the moments that matter. Now, today's episode is going to be about everything superstitions, about Jamaican grandmothers being part of the village, and we're going to be talking about the history of midwifery in Jamaica. Now, my guest for today is no other than my own mother-in-law. We call her Auntie Vern, and you'll find out why we call her that. So if you're a mama in the making, already a mom, or you're someone who loves a good baby hack, then this episode is definitely for you. So let's dive in. Hi, Auntie Vern. How are you today?
I'm good.
Awesome. So welcome to our podcast. It's been a long time that I've been asking you, but I finally get to hear, so I'm so happy. Now, today we're going to be talking about so many things, but you've been a midwife for 40 years, or you are now retired, but you practice as a midwife for 40 years. What was your journey like as a midwife?
Wow. It was an exciting journey. Because I believe this was what I was made for or born for. And I put everything in it that at the end of the day, I feel so satisfied for what I have done throughout the day.
So how did you even get into it in the first place?
How did I get to be a midwife? Well, from I was small, I know that there was something there for caring, for nurturing. And so when I finished high school, I chose to apply to the Kingston School of Nursing for nursing because I was not sure what aspect of nursing I would want to do. And when I applied, I passed my exams and all of that, but was told that the nursing aspect, they had too many students, so they could not take anybody else until the next year. But for midwifery, there were open positions, so I accepted.
And that's how you became a midwife?
And that's how I became a midwife. So I was sent back to Cornwall School of Nursing, where I was trained as a registered midwife.
So what was midwifery like back in those days in 1982? What was midwifery like?
Well, in 1982, it was different. I was young, but yet we were more committed. We were more caring than now. I find that those days, midwifery on a whole was different. We had more passion. There were more passion for the patients. We would go the last mile. And up to now, I work that way. But my observation is some of the new midwives, it's like they come in with a no caring attitude. And it goes for, I think, every profession, depending on how you were cultured.
Yeah. So were hospitals common in that time? What was it like coming? By the way, who was even caring for the pregnant mothers before?
Okay. Prior to 1886, mothers were delivered in homes by who you would call Nana or middies. These were very elderly persons who came and see to the birth of women having babies in their homes. However, these women were not trained, you know. So these were the persons who really came and assist in the deliveries.
Okay, so where did they get their knowledge from, though?
Well, these people had no knowledge. They just work according to their common sense, what they were doing and what they believe or think they should do. Because in those days, prior to 1886, when there were no trained midwives, these persons doing the deliveries, there were a lot of maternal deaths. Women were dying in pregnancy. Babies were dying, newborn, neonatal deaths, you know. And it was so high because these persons could not and were not able to identify abnormalities. They were not able to take care of a pregnant mother and know some of the things to look for. So they were just doing their own thing. And when the woman go into labor, they don't know what was happening. The woman was bleeding. They don't know why the woman was bleeding. The woman cannot have the baby. The woman was in labor for hours. So they didn't know what to do. So lots of times, some of these mothers, they have high blood pressure. Nobody checked. Nobody know. They were not trained. And so they did their own thing. Women having fever, infection, all kind of stuff. So there were women who die in child's birth.
Yeah.
And when these women start going and dying, these people run away in the bushes. Because you know the police is going to come. So when the police come, they don't find anybody. It appeared as if the woman was in labor, you know, and then something happened and she died.
Yeah.
You know.
So you mentioned that there were a lot of neonatal deaths. The maternal rate was really high at that time. And I believe that is basically how midwifery came about in Jamaica. Tell us a little bit about that.
Well, when the government then of Jamaica realized that we are having too much mothers who are dying in labor and babies dying, you know, from other things, infections, sepsis, you know, jaundice, you name it, coming out flat, long deliveries and all of that, bleeding and all of that. The government said, no, we cannot continue like this. We must do something. So there and then they institute the training for midwives to be trained. And the training began at the Victoria Jubilee Hospital. Okay. And up to this very date, midwives are being trained. Clinics are built in each community, rural, deep rural, urban communities, so that midwives are placed in these clinics to work so that they can see to pregnant mothers, identify abnormalities, send them to high-risk clinics, and deliver them at home. Some mothers would be seen at the clinic, examined, and there are certain criteria for home deliveries. Women are still having home deliveries, home births today, because the midwives are so competent. When they do their assessment and examination, they say, no, this woman cannot deliver. Your pelvis is not adequate. This woman is having some high blood pressure. You have a little diabetes. You have to be referred for higher care.
Yeah.
And so many things. You know, fetal heart rate, they have to check to ensure baby is doing well on a regular basis. Babies are sent to hospital if there's a problem and all of that. So initially, there was nothing like this. So that's why the maternal mortality and the neonatal rate went down dramatically. That the government was pleased.
Right.
And so they continued training midwives, building new schools, and ensuring that midwives are trained to conduct this kind of care in all communities and hospitals.
So basically the midwives then would have been a replacement for the middies and the nanas.
Yes.
First of all, let's just give a disclaimer that this episode is not about criticizing or trying to shame Jamaican culture or anything like that, because we are part of the Jamaican culture, you know. And one of the things though that came out of the culture or the cultural aspect of having nanas and middies would be like the superstitious beliefs that come about nowadays. So if we had women who were caring for the mothers, of course, if you're a young mother and you have a woman who delivers you and the woman would bring your baby, you know, like help you out and all of that, then you're going to basically believe whatever the woman says that you should do. So tell us a little bit more about how the superstitious beliefs come about and how has that played a role or played out in your journey as a midwife?
Well, a lot of these beliefs, as we know, they came from our elders, our foreparents, and even out of Africa. There are so many beliefs, especially where evil is concerned, especially where voodoo is concerned. And there are so many things that our elders did that really prove that a lot of their beliefs are about evil spirits. You know, so there's a lot of them coming out of Africa.
Yeah.
And in my journey, I had a lot to deal with. Because I was delivered by a nana.
Really?
Yes.
Oh.
And in those days, I could have adopted a lot of these beliefs and superstitions. But at the end of the day, because of new knowledge, learning, education, which is power,
Yeah.
you know, I was able to look at it realistically. And when I look, I realized that a lot of these make no sense. There are so many beliefs that came from the nanas, from our foreparents, that made no much sense. And I was able to educate these mothers. At some points, I asked them to bring the grandmothers to the clinic when they come with the babies, or to come with them, so that I too could educate them, so they could, you know, get some knowledge, you know, of what taking care of a mother and baby is all about.
Yeah. So you definitely have helped them to not just say, okay, you know the role, but you're also there trying to educate as well.
Yes.
What has the response been like, though, from those grandmothers who you would have come in contact with?
Well, there are grandmothers who come. Some of them remain silent because, you know, it's not easy for change. But there are some of them who were apt to learn. They were happy for the information because they have never heard it before.
Yeah.
You know, it is coming from their great-grand and grand too. And when we educate them and we show them the rationale behind all of this, these persons, some of them really accept. We will find some of them who were difficult to accept. And they would go back home and say, nurse don't know nothing and all of that. Then these are young nurses and what have you. But the response was really good from some of these grandmothers.
Yeah. So what are some things, though, from that time? I mean, like from the nanas, the middies. What are some of the superstitions? Probably not the superstitions, but what are some of the practices that may have actually been good practices from that time?
Well, I believe that they had good intentions.
Okay.
It's just that they had no knowledge of how to go about them. Even the fact that they would put a Bible over a baby's head, say for protection. They believe that the word of God is strong and powerful. And they believe that if they open the Bible to a certain psalm or a certain scripture, they believe that the enemy would be afraid of the word of God, you know, and that the babies would be protected. So that is one instance where I see they mean well. They really meant well in protection for the babies. And all the things they do is really for the protection, but some of them make no sense at all. You know, there are some things that you can correlate to say, yes, you know, this might make a little sense, or, you know, because it's in the protection of babies. Mothers, babies, what they do.
So let's dive into the things that were more so harm than good. What are some of the common practices that come from the grandmotherly days that you really want to debunk in terms of, let's start from pregnancy, because it really starts from there. So a woman becomes pregnant and she may not be living with her grandmother, but she may be in contact with her grandmother. What are some of the common superstitious beliefs that come about through pregnancy or from pregnancy?
Okay. So there are what you call minor disorders in pregnancies that pregnant mothers experience. But some of the grandmothers do not believe some of them. For example, the uterus will be growing, or the womb, with a pregnancy. And because the woman is having, for example, heartburn or burning from maybe too much acid, acidic food, spicy food, and all of that, the grandmother would say, this is caused by the baby's hair on the head, up here. So that is what is causing the burning.
Right.
You know? So we would educate them and let them know, for example, that no, the baby is in a bag or a sack by itself, and it has nothing to do with here, up here. It's two different places.
Yeah.
You know? There are so many other beliefs. That is just one. There are so many. They believe that the baby was growing all the way up and going up into your chest. So they put a rope or a cord around the waist between the baby and chest to prevent that. And we had to educate. There are some things that they should not do. They should not drink out a bottle.
What kind of bottle? What do you mean?
Soda bottle and all of that.
Okay.
Baby will stifle and all those kind of things. You know.
And I've heard too that pregnant women should walk over ropes because that will cause the umbilical cord to wrap around the baby's neck. You ever heard about that one?
Well, I have never heard that one. You know, but there are so many. You know.
All right, mamas and friends, let's pause for a second. Here's your memory minute brought to you by Little Memories JA. Before you take a photo of your child, tap the face to focus on the subject. This will ensure that you get sharper photos with your phone. Stay tuned to the end of this episode for 10% off your first or next photo session with Little Memories JA. So tell us about some more practices that happen when the baby is born.
Well, when the baby is born, mother wants to use Dettol, Savlon. Now this baby is coming out of a warm place. For those who want to tidy them or to put they want to put disinfectant in the bath water. If they're going to bathe them, some bathe, some don't bathe them. They don't believe in bathing them. But they would want to add Dettol and Savlon. But Whitney, look at us so big and old. And we have not been using Dettol and Savlon on our skin. And a baby that is just born. I saw a baby one day, and when you look at the bumps on the face, alarming. When you look at the bumps and the rash as a result of the chemical, which is so harsh. Persons are using even cake soap, all kind of stuff to bathe the baby. And their skins are so sensitive, delicate at this time that sometimes you don't need to use soap or anything at all.
What about baking soda? Because a lot of people talk about using baking soda in water.
At the initial stage, you don't use baking soda. There's no need. When you use something, there's a need for using it. And there's no need to use baking soda in that the baby is clean, nice. Why would we want to use baking soda? Because it sometimes dries the skin out. We find that when the babies become bigger and the time is warm, hot, and you see they're getting heat rash, sometimes we would ask to put a small amount of baking soda in the bath water, which would help with the itching and help to reduce the little pimples, you know.
But when you say older, like what stage?
Like about 6 months.
6 months or older.
You add. But it tends to dry the skin on a consistent basis that you use that.
So we asked on our TikTok about some of the practices that happen with babies and mothers. I mean, we're at the stage now where we're talking about after the baby is born. So you can tell me if you've heard of any of these things and what you think about them or if it makes sense to do anything like that, right? So you spoke about bathing the baby in blue and baking soda. That is not safe, right? Now, what about putting a piece of thread when the baby has hiccups? Rolling up a thread and wetting it up and putting it on the baby forehead. What about that one?
There is no truth in it. Hiccup caused from a little wind in the stomach. And if you breastfeed, just give the baby some more breast milk and you find the hiccup will go away. There's no rationale that we learn or we're taught. Where a little thread or a little matches stick putting in the hair would reduce or will stop that hiccup. It's not proven.
How about planting the navel string under a coconut tree?
Well, this is coming from I believe, we elders. Because, as I told you, I am from farmer. I was born and delivered by a nana. And I heard my father, when I grew up, I saw my father had a medicine chest. And he had all of us navel string together wrapped in something. And what he did, he went outside and plant a tree, an orange tree there. But for what reason, I don't know. It bare and we ate orange. So I don't know what's the rationale of doing that. But it makes them comfortable and it didn't harm the baby.
What about this one? Putting your finger in your private area and mark the baby to protect them from dopey.
Oh, my God. That is so wrong, Whitney. Sometimes the private area carries so much organism.
Yes.
Yeast infection, thrush that some persons might say, and other vaginal infection, bacteria, and all of that. And we wouldn't want to do that.
Oh, man.
That's really not to be done.
What about not letting the sun go down on the baby's clothes while it's on the line?
I can't pick up that. I heard of it, and I don't know. I forgot my baby's clothes outside, and they stay overnight until the next day, and nothing went wrong.
Exactly.
Even one lady came, said she wanted to take care of my baby. She'll hang them upside down so that duppy won't follow them. I want to see that this is coming tradition, where it's coming way back, where our people really believed in duppy a whole lot.
A lot, yes. I feel like a lot of these things are about protecting from duppy.
Yes.
But, funny enough, for everything that has anything, me not believe in a duppy in the first place. So anything what I have to do with duppy, I always tell people, me feel like whatever you believe is what will follow you. So because me not believe in it
Which is
follow
true.
me.
What you perceive,
Exactly.
it's important.
Exactly. How about don't allow a female that is on their period to hold the baby because it can cause the baby's belly to hurt them?
Not at all. There's no truth in that. It has nothing to do with that. The woman is bleeding even after she have her baby, and she have to hold her baby.
Oh, Lord, I never remember that.
She's bleeding, and she have to hold her baby, so I can't see.
How about opening the Bible at the baby's head?
Well, that's another belief, that they believe that will also scare demons or duppy or what have you.
And putting tape measure over the door.
Yes, they hang tape measure from the roof to the door and all of that to prevent the duppy from getting to the baby.
Yes.
They even put corn on the door at the front, so the duppy will keep counting, and they can manage counting until they have to go.
Really?
Yes, the corn they hang on the door.
Weird.
Yes, it's a lot of belief former times.
So how about putting something red on the child's hand or making the child wear red? And that is another running duppy story.
Well, that is one that I've seen a lot when I work at the health center. A baby will come in with a red scrunchie on the arm. And I've even seen one with a red piece of cloth around the neck and a big nutmeg that bore a hole through and push the
nutmeg,
that red cloth through the nutmeg and tie it around the neck. And I had to say to the mother, but my God, I really would love a nutmeg to put in my porridge. And if you did not bore this one, I would have taken it home. This make no sense. And even for this scrunchie on the arm, sometimes I have to take them. And I say, that if you really bless this baby, pray for them, they will be okay. Evil spirits are all around. But we don't need to embrace, and allow our children to come and to take on all of this. So I prayed for them sometime. And sometimes they take off the thing.
The scrunchie right away.
I said they didn't know, it's my grandmother tell me. So I said there's no,
Yeah.
But they believe these things and we don't really take it from them, but we educate them.
Yes. All right. This is another one that I could have figured out. Squeeze the milk out of the baby breast to prevent stink arm in the future.
Yes, that is a lot. We got that a lot in our practice, where the mothers came and come to the health center, and we see where the baby's breast is swollen, sometimes red and painful. I had a baby one time, and when I looked, one of the breasts was abscess. The mothers believe, grandma said, to squeeze the breast, and that's not milk. That's some withdrawal of hormones from mommy. And that will eventually go. But they were taught to squeeze, and it will protect the arm. The baby's arm won't be smelly. And that's not true. There's no truth in that. So we had to educate these mothers and say to them, no, leave it alone. When you squeeze, you leave an opening for infection. So when it goes in, baby's breasts become infected. And we had to send one to the hospital for them to incise and drain pus from the breast. So that practice should really stop because there's no truth in it.
Yeah. Now, when the baby is about to walk, it's another thing. So people believe that, first of all, they should use a broom and sweep the baby foot to make them walk faster.
all babies who will walk with me at various age, between 10 months. Some babies now are walking from 7 months, 8 months, 10 months, 11 months, 12. And even over a year old, you find babies not walking. But they will eventually walk. And sometimes it has to do with the stimulation from home. Some mothers have them in bed all along, and they don't put them on the floor, you know. And I had a baby one day when the mother said, baby not walking. And when I put the baby on the floor and have him, the baby start walking, the mother almost cry. So some of it is just mere stimulation, the need, you know.
So I heard too that you can use the bath water and throw it in a walkway, and that will also help the baby to walk fast. And I'm sure that this does not make much sense. What do you think though about this one? Don't show the baby's face on any type of media until the baby is christened.
Oh, please. That has nothing to do. That's nothing to do with the baby. Why would we not want to show the baby's face? What will it do? What harm? It makes no sense, Whitney. It makes no sense.
So, I've heard though on the side of mothers, right? So, well, one last thing that I've heard is don't let anybody play with the baby over your shoulder. You ever heard that one
yes,
before?
Yes, I heard of it behind you.
Yes.
Because maybe some dopey will follow and all kind of stuff.
Dopey. So what do you think about breast milk giving the baby colic or breast milk burning the baby on their face?
No, God is so good that he made breast milk for babies. Mothers with breasts full of milk, and he's going to allow this breast milk now to burn up the baby's face. Breast milk we have, say for example, you have 100 babies. All babies' face should all be burnt up. Who are breastfeeding. And you might see a baby with some white patches on the face and so on. It can be from an allergy. It can be from eczema. It can be something that mothers put on the baby's face. So breast milk cannot burn the baby's face. It's not hot to burn the baby's face. There's nothing in there to burn the baby's face. No chemical, nothing. Whatever is there is for nutrition. So that should not have anything to do with burning up baby's face.
That's so true. So, Auntie Vern, tell us now about the beliefs and the practices that you remember that are common with mothers, because it's not just on the side of babies, because there's so much too about the mothers after giving birth. So tell us about that.
The practices after birth. Well, as I said, in former time, and I believe that it's still happening, where if persons assist in delivery, even Anana, say, for example, still do that in the deep rural. They believe in putting the woman over a basin or a big wash pan with a piece of wood across it. You sit there, and that heat, warm, boiling water in that pan, and you sit over it. Then the woman starts bleeding, clots. And the person would say, oh, this was so good. Then when the woman bleed enough, they don't realize that these clots are caused from bleeding. It's bleeding forming clots. So the woman start to get weak. And when the woman pass out, then these people usually run away. I want to believe that it is practiced, but not as before, in that there's introduction of midwife. That is one practice, where some people still embrace, you know, and I would wish they would understand that this is bleeding and the woman can die. Okay?
So, but there is something that is called a sitz bath, which is recommended for women who have a laceration or a tear after giving birth. Now, that is totally different from what you're talking about, which is basically steaming over boiling hot water.
Which is different.
Because one of my moms even told me that her mother told her to put turpentine in the water in order to steam over it.
Right, so I'm telling you that the practice still happens, which doesn't make any sense. It causes bleeding. Say, for example, you have an open wound. You have an open area in the uterus where the placenta was, right, which will heal. And if you apply heat, you would find that the woman will bleed and can bleed to death.
So what's the difference between that and a sitz bath then?
A sitz bath is totally different. A sitz bath is when a woman gets vaginal tear, when the baby is coming through the birth canal, and the introitus, the vagina is a little tight, so the midwife would either cut the area to make it easier for the baby to come through. Sometimes it's torn before, you know, she could do that, or, you know, so the doctor would come and suture. Midwives can suture too. Come and suture the area. And after suturing and antibiotics, painkiller, you will ask them to go home and to do a sitz bath.
Right.
A sitz bath now is when you get home, you have you boil water, mild salt and water, right? Cool, and you sit in it. You sit in that water for about 15 minutes, right? And that will help in the healing process of the laceration, right? Or the sutured area.
So it's not water that you cannot manage to sit in. It should be enough.
It should be enough and at the right temperature you can sit in. But some patients come and say, the nurse when say me if you sit down over the water. So me say no, sitting over the warm boiled water would not help to heal. You sit in and allow it to soak, like maybe twice per day for a few days. And you find that the process, you find you're getting better, you're feeling better. Areas healing up nicely, you know?
Yeah.
So that's sitz bath.
Okay. So any other thing that, well, we also got some response as it relates to mothers, right? So let's talk about that. First one, I've heard, this is very funny, but I've heard that mothers should not open the fridge door when they just have a baby. And most of these, I'll just categorize most of these beliefs under the whole thing that mothers can catch what is called baby cold in Jamaica. So one is don't open the fridge, and the second one would be don't wash your hair after having the baby, or don't go outside after like a certain time of day, like 6 o'clock. What are your thoughts on that?
Well, those are on the side of caution from our elders. Really, really care, you know, and we do respect them. But at the end of the day, when I see a woman coming back to the health center, 6 weeks, they have not yet bathed because grandmother says, no, you will catch a baby cold, right? Their hair not washed. And when you look in the hair, sometimes it's scaly. The baby is filled with rash all over the face because some of this is coming out of the mother's hair while you care for the baby. Baby's hair start build up with what you call cradle cap, you know, from the oiling and all of that, and they like what they did, the head water that was here before. Babies were not bathed, hair not washed and all of that. And they start having skin rashes. Right? So we had to educate.
Yeah.
Sometimes, as you said, they said, do not go into the fridge. If you have somebody to go in there, you can make them go in. But there are times there are mothers who are alone and they want something in the fridge, so they have to wait until somebody come from work. You can go in the fridge. You don't have to spend the whole day in the fridge. When you go in the fridge and take what you want, shouldn't do you any harm. But as I says, your mindset, your perception is kind of, can override you, you know, and reality.
What about mothers banning down their belly after having a baby? Because people believe, say, you must get something tight. Even use the baby blanket, somebody say. Use the baby blanket and tie down your belly so your belly go back flat.
Okay. After having the baby, there's a lot of discomfort in your lower abdomen. And that is not the wisest thing to do, to band your belly. The wisest thing to do is after 6 weeks, you find out about the postnatal exercise, you know, that you can do, which can allow your belly to go back, or your shape, to get back your shape. Right? So banding the belly is not the best thing. There can be so much discomfort, and mothers can also bleed. You know, it's uncomfortable. You need to leave yourself to heal. And not to mention those who have had cesarean section. And you're banding this belly. It takes some time. And at the end of the day, they must realize that breastfeeding also helps for you to regain your figure.
Yeah.
And your belly will go back to normal. But we have a lot of mothers today, Whitney, who do not breastfeed. And by the breastfeeding for a month, they stop. I know work can be a challenge. But at the same time, if mothers can breastfeed for a longer time, even up to 6 months, I know it might be difficult to work and all of that. And when I say breastfeed, I mean exclusive breastfeeding. Breastfeeding alone for the first 6 months. You gain your shape back, you would be surprised. And then too, you can go for your exercise because you have gained weight and a lot of fat is there. So exercise will eventually help. Right? Some of the mothers not able to go wherever to get the exercises. But you see, you're at home. If you line up that back of yours against a wall on a daily basis, pull your belly in, Pull your bottom in as if you're trying to hold some urine. And you do that for twice a day, for a couple of days. You find out that your muscles gone back and get tighter.
Yeah.
So that's another means.
Awesome.
Yeah.
So I'm trying to remember if I've ever heard anything else that really puzzled me. But one of the things I think I've heard that women who have done a C-section that they're told to drink Pepsi after delivering. What are your thoughts on that one?
Well, women don't have to drink Pepsi after delivery. Any drink can be had. But at the same time, if a woman had a cesarean section, for example, for hypertension, you might know that caffeine in Pepsi and coffee can elevate the blood pressure. And if blood pressure was a cause for cesarean section and you giving Pepsi on a regular basis or giving Pepsi, you wouldn't want the woman's blood pressure not to settle. You would avoid Pepsi then or anything with caffeine so that the blood pressure can be settled.
So as it relates to the care, because you spoke about the fact that, yes, it's important for women to still keep up their care and stuff like that. There's one more thing that I've heard in terms of women, you know, like, first of all, is baby cold even real? Is it real that somebody will catch a cold if they don't maintain certain conditions after having a baby?
You mean the mother and the part of the mother?
Yes.
No, I have not seen it. If a virus is going around and cold going around, you can catch a cold. But you shouldn't have a cold, baby cold, from whatever they say you're doing, having a shower, washing your hair. You can use warm water if you're on the safe side. But you should wash your hair and you should have a daily bath. Because at the delivery, after the mother is delivered, they have a bath. We teach mothers how to bathe baby immediately the next day when baby is born. And nothing is wrong with babies. Right.
No, there are a lot of beliefs and we can't really get into every single one of them, right? But what would you say to Jamaican grandmothers who, I mean, you've come across a lot, as you said, you've called them in, spoken to them. What would you say generally to grandmothers, especially those who still retain their beliefs from way back then?
Okay. With due respect to our grandmothers and great-grandmothers, you know, I could have embraced some of these because there are nurses who still embrace some.
Right.
I could have. But with new learning, with education, which is power, I realize that there's no rationale in some of these things. There's nothing to substantiate, say this is this, or this will make this, or this, that. So to the grandmothers and great-grandmothers, we really appreciate you. You have been very helpful. You have been good to some of these younger persons. But at the same time, there are beliefs. You know, there are myths that some of them are definitely not true. Most, if not all, not true. And if grandmothers can listen, because some of them do listen and some of them do learn, and some of them are very thankful for the education because they did not know.
Right.
You know? So I would encourage grandmas, great-grandmas, you know, senior members, relatives, you know, to think of what we tell them. Does it make much sense? Do you think that learning and new learning is important, where we can pass on to our children, grandchildren, so that we'll get rid of some of these myths that make no sense? So I would advise them, you know, even though you have learned all of that, it's not easy to let go. You know, but we can adjust and we can look at what we have learned, look at what we are now learning and think, does it really make all that sense?
So it's really then about embracing the education that is coming about now versus what you believe in. But first of all, we did talk about this one because I've covered it in 2 previous interviews, but there are still a lot of people, Auntie Vern, that do not agree with what the doctors themselves have said. And this is about, 1, bush tea, right? About things that people give to babies. What are your thoughts on that? Because a lot of people still think that what the doctor is saying has nothing to do with the fact that back in the days, people used to raise their children on bush tea and never do them.
Okay. So From my point of view, or logically, bush tea is sugar with a bush, whichever bush with a mint or whatever you boil together. What are the nutritional value in bush tea? Glucose as well is another thing that the belief is that baby must get glucose after birth and for some time. These have no nutritional value. This is glucose is beverage. Yeah, they talk about beverage, sugar and water, they call it beverage without lime. And how can we feed a newborn on sugar and water? They'll become malnourished. This has no nutritional value. What is the reason? What is the reason behind bush tea, sugar and water to raise a child? They won't learn. Going to school, they won't learn. The best thing for your baby is breast milk at birth, immediately after birth. Mothers must be prepared to breastfeed. Some mothers are not prepared. That's why they don't want to breastfeed.
But some people might be fearful of what breastfeeding might do to them, like the slipper's breast. How you address the whole concept of your breast getting flat?
When you become pregnant, your breasts become enlarged, as you know, with the hormonal changes. We encourage mothers that you need to be consistently wearing brassieres. Because if you have one balloon, Whitney, and the balloon full of water, and you throw out the water and let it go, what would you notice? It will be stretched. If you have another balloon, right, and you hold up the water in it all the time, there will be a difference.
Right.
So mothers wearing brassiere during pregnancy, after delivery, will support the breast tissues, and I suppose the flat breasts or the slippers they will not experience or not much. You know, we know that the breast would stretch a little, but not to that extent where they don't wear any brassiere. So the tissues stretch and the breast reach down to your waist.
I must say, I myself have experienced changes, you know, in my breast, but I wouldn't say my breasts look like slippers compared to back then, but I appreciate my body for what it has gone through and the fact that I fed a whole entire human being for months.
6 months.
For
I mean,
16,
exclusively.
6 months exclusively. Yes, but for 16 months, you know, combined. So we definitely have to address these things because I don't want to just tiptoe around the fact that there are so many beliefs, and I feel like, for instance, with my mother, when my mother gave birth to me, she would have been a younger mother, and she would have, you know, basically respected her elders in such a way that she would not question what they would tell her to do. But in my stage of life now, where I'm quote unquote maybe a more mature mother, because I feel like in those days people were having children when they were younger, like 18, 19, thereabouts, you know. I'm a 30-year-old mom, technically. So if you come to me now and say I should do this, I'm going to question why should I do this? To me, it doesn't make much sense for me to do this, especially if it is something tied to duppy, because me not believe in a duppy from the get-go, right? So I would also implore moms to think, what is the reason behind this belief? And is this something that I believe within myself? Am I going to just do it because somebody say me fi do it? Or am I doing it because I actually believe? And so even when people tell me, say, when the baby a teeth, don't wipe the baby more with no rag, because the teething water will turn back and go down in their belly and hurt it.
Make no sense, Whitney.
I'm like,
every baby who teeth, the gum becomes a little tender, right? Uncomfortable. And most times this is the reason why the baby's mouth are usually open, to get some relief, you know? And if you should put some cool gel from the cooling thing you put in the fridge and cool the gum, you do some support. You know, so the fact that what they say about teething water, baby will always have water pouring from the mouth. Babies will always be swallowing. And baby will be swallowing some of this water from the mouth. So every single baby should have come down with diarrhea or something if they said this is what caused it. Because they were saying is the teething water turned down while babies have diarrhea. Which makes no sense. All babies swallow whatever water coming out of their mouth. So you do Panadols or something if the mouth is uncomfortable, or you get a teething ring to relieve. Don't give the babies too warm a feed. Baby don't necessarily have to drink warm feed. Baby can drink feed.
You can't tell people that everybody thinks that the baby should get something warm, especially in the morning.
That if you do what? My sister would say the warm thing is to what? To get rid of the froth off the stomach. I've never heard this one. Not the important thing is that the baby gets something in the stomach.
Exactly.
To occupy where the gas is or whatever, or to satisfy them. It doesn't matter. It doesn't have to be too cold. And when they're teething, it doesn't have to be too warm because the mouth is already in trouble.
So room temperature is fine.
Room temperature is fine to feed your baby.
Yeah. And some people might not even know that it is the warmth that is causing discomfort for the baby when the baby is teething.
Right.
But because it's so important to give them something warm.
Yes. And the poor mouth is in trouble already. And then they're giving them the warm, and sometimes it's too warm. You know?
Yes.
And the baby start to be uncomfortable.
Yeah.
So
that's
basically
so true.
that is true.
No, you became a grandmother yourself. That's why we're here in the first place, right? And so even though you have a background in midwifery and you've seen so many things throughout the years, you became a grandma. And so I would say I really respect, the relationship that we would have had in the past, not dealing with you as my mother-in-law, but as the grandmother of my child.
Right.
And so I would have realized that your ways of doing different things, even if you didn't agree with everything that I said, because I don't think we agreed on every single thing.
Right.
What was your approach, or what would you say informed your approach, becoming a new grandmother, even though you were already a midwife?
Okay, you have to look at respect. And even though you are my daughter-in-law, I think I need to respect you. And if you are saying something to me that I'm not in agreement with, it's not for me to overpower you and to say you're young and you're fool and what have you.
Right.
I respect. And most times what I would do, I would ask questions. Whitney, what do you think about doing this way or that way? I don't push it down your throat to say you must do this or you must do that.
Or the famous, you need to do this.
You need to do this. I would ask you what you think.
Right.
That's your way. What you think about my way? Will we come back out? Will we have the same outcome if I do this way and you do that? Because the important thing is the outcome.
The goal, yes.
The goal that we're going towards, is it the same outcome after you do that and I do this?
Yeah.
So respect is one of the things. And to understand that you're now a mother. You're no longer a child. You're still learning. And at my age, I am still learning. And I have learned from you. I've learned a lot from you. Because maybe I have not researched as how you have researched even now.
Yeah.
So we need to respect each other. And irrespective of your belief, we can say nicely, you think that if you do it this way, it would work better. What you think about that way? What's the rationale in you doing this? Or doing it that way.
Yeah.
So I believe that this is the way. And I think the main thing is respect.
Yes.
And to understand that young people, not all young people, because teenagers, some of them not ready for babies yet, but adults who are ready for babies, they are growing and they are raising a child and they need the support and they need the respect.
Yes.
And that is very, very important. You don't push a thing down the throat. You must do this. You have to do this, whether you like it or not. That's not the way.
Yeah. So what would you say is... respect definitely, but in your experience, especially as a grandmother, what would you say is the most important thing for grandmothers to do in helping to support or to become part of that village that a young mother, or not a young mother, a new mother really needs, especially in those early weeks? Because I would not want to have a grandmother who's around me, who's part of the village, but feel like they're adding burden instead of helping me out in those first few days or weeks. What would you say is the real need of mothers during that time?
Well, at the early stage, mothers coming home with a baby. You have never had a baby home and all that it comes with. And it's a lot. Sleepless nights. Right? You are in pain depending on your mode of delivery. It could be a cesarean section. It could be a normal delivery. You're still having discomforts and so on. So I think the mothers need support, emotional support, right? And they don't only need it from a grandmother. They need it from the partners.
Yes.
And sometimes, even though the grandmother tried to fit in and to ensure they are okay, there are needs, psychological needs within the woman that is craving for a mother and a partner.
Yes,
and especially a partner.
Yes.
You know?
Yes.
So the support is very good. You need help at home sometimes. I've seen mothers that go home and nobody. And I've seen mothers coming back to the hospital and to the clinic in depression. And that does not cut it. It doesn't make sense. And because they don't have a support, partner is away, partner not supportive, or mother is away, mother not able to help or they died, no support, and they're alone, and sometimes they have other siblings. And to be going around looking about these babies without support, it's really a lot. It's very stressful.
Yeah.
So the support emotionally, psychologically, physically, physical help, allow her to sleep. Sometimes they don't sleep at night. You always sleep on your bed at night time. For the whole night and you don't sleep none at all, you're going to be stressed out. So it's good to have some support in the early stage, and you observe the woman, Is she sleeping? Is she stressed? Take the baby, send her, make she get some sleep, So the support is important.
Yeah, that's so true. And talk a little bit more about how grandmothers now can, because you mentioned something, emotional support. That is so important. What do you mean when you even talk about emotional support? Because I know a lot of people don't understand what that is.
Well, you must be there for the person. You must be able to listen. You must be able to observe. You must understand the needs of the person and be there for them. You're not going to take over, because some grandmothers take over and the mothers don't have a chance to even hold the baby for themselves. That part is important as well. So some of the mothers don't understand how to care for a baby. But the emotional support that they need, they want somebody to come and say, are you okay? How you feel mentally?
What can I do?
What can I do? What else you want me to do? Would you like some soup? What would you want? Are you having pain? Should I call to get some painkiller? What should I do? You must be there for the person in various ways that will make them comfortable during this journey of postpartum. Because there are mothers who have gone into depression, throw the baby through the window, all kind of stuff. They don't want to see the baby because there were no support, nobody to even say, how are you, what's going on, and they find themselves all alone in this situation, in this journey. So support, especially emotional support, is very, very important.
We spoke about the advice that you would give to grandmothers, but what advice would you give to new mothers in terms of them helping to keep or to create healthy boundaries with grandmothers? Because what if I'm a new mother and I have people around me and they really want to support, but I feel more burdened or forced with their support than supported as much as I could? What would you say to new mothers?
That's a very important question, because things have changed, but the right way of having children and raising children is to move away from mothers and grandmothers. I know circumstances would allow, women, younger women, to be with mothers and grandparents, for support and all of that, because the relationship possibly was not right, or out of what reason they became pregnant. But I would say that mothers must still respect their mothers, young mothers, grandmothers, and mothers, irrespective of. I have had mothers who are learned, and irrespective of what the grandmother is saying, with respect, they choose to stand up for what they believe. They understand that some of these myths and beliefs are wrong, and it makes no sense. So when they are imposed on them by the grandmothers, and the mothers and the extended elder family members, they decide, no, I'm not going that route. And sometimes they are upset. So they will come back and tell us, nurse don't know nothing. Nurse a young nurse. Doctor a young doctor. They don't know nothing. You must listen to your elders. But I would advise them, become learn something, become educated. Education is power. And when you are educated about anything at all, especially taking care of the baby, you know, and some of the things that is important to know, you know, then you are better able to express yourself to your elders and to say with respect, Mommy, Grandma, I understand what you are saying, but I have learned some stuff, new stuff, and they make better sense. Some of them, I appreciate what you have been saying, but some of this stuff make no sense.
Yeah.
Sometimes you have to come up front. Some of them make no sense. And because I've learned this, I want to embrace this. Allow me to embrace some of them. This is my baby. Not out of disrespect. Because once you say this is my baby, you know, they take offense. You know, but you need to become responsible, understand your baby, grandma, and others won't be around forever with you, and you will have to stand on your own, take care of your children, right, the best way you can.
Yeah, that's so important. And I would just like to add my piece, you know, for moms, because, as I said, we've been in the same situation. And I must say publicly that I appreciate you. And I also appreciate my own mother, too, for the role that she played in my postpartum stage. You know, but I would want to say to new mothers that it's important to embrace the support that you have around you, but in helping to set healthy boundaries, you know, because sometimes our mental health needs a breather from too much opinion. Everybody has an opinion when the baby just born. Everybody are expert in a raising baby. And babies don't come with a manual. But at the same time, first of all, the important thing to me is to find a good pediatrician. Because to me, my pediatrician is the authority on when I need my questions answered, the first person I'm going to find you because you're a midwife. But I also ask my pediatrician. And a lot of times too, you say to me, reach out to the pediatrician.
Right.
But a lot of grandmothers may not tell their mother, the new mother, to reach out to the pediatrician. So I say to people, when people come to me too, I say, have you found a doctor for the baby? So one of the things I would say, find a good pediatrician, right. One who is accessible, one who you have their number, you can call them, you can text them, send them a picture, say the baby have this type of rash on their face, what should I do? Right? 100%, that's the first advice that I would give. And further on now, I would say that whenever you feel as if there are boundaries being crossed in a respectful way, you can say, hey, I really don't like, your way of doing it, or I think that I have learned something and I want to try this way. Please allow me to do it this way, and then I can either apply, let me do what works for me. Allow me to do what works for me. Because at the end of the day, as you said, the outcome is what is most important. And sometimes we might get a different outcome too, but don't say, me did tell you say it never go work. But at the same time, allow me to try too, because people learn from their mistakes as well, right? And there can be lessons in the whole process. So for a new mom, I would say take it one step at a time, find a good pediatrician, know who is part of your village, say to them, hey, I have a baby and I know that I may not know everything, but at the same time, I will listen and respect what you say, but I may also not choose to follow everything that you say. But even in not following everything that you say, I want you to respect my choice, respect my decisions, and also just keep the peace overall. Because I know some people may fall out over stuff like that. And it's important. Now, Auntie Vern, I'm going to ask you two questions that we usually ask everybody. And the first one is, what do memories mean to you? How important is it for you to capture memories? Because even though you've been around since a long time, when you have film camera and you go lab, go process and develop and all of that, how important are memories to you?
Memories in terms of?
In terms of photos, in terms of videos, because you are always requesting photos and videos of your Miss Minnie. So what do you say?
Well, now I realize how important memories are. With your first child, most times you would do all the pictures, pregnancy, everything.
Yeah.
Then it seems as if, I don't know if you get tired, you know, and then when the other children come by, you find that you don't do as much. But now, looking back, I can hear my children asking me for pictures of the past. And for the first one, he had so many pictures. And the second one, it seemed like I was so tired that I didn't do so many pictures. So when he asked me, there are some pictures I cannot come up with.
Yeah.
You know, but so memories are important of what the child did then, you know, what was happening then. And when you look back as an adult, you know, they too can appreciate you for some of the little things as a baby that they usually do, say, how you care for them, you know, how you monitor them, you know, whatever you did. Memories are important. It has a long-lasting, it can have a long-lasting effect, and it can cause your children to embrace you even more when they see some of the stuff that you did for them, you know? Yeah, so memories is important.
Great. So if memories are important to you too, then you can use this discount code for 10% off your first or your next photo session with Little Memories Photography. The discount code is Moments10. That's Moments10 for 10% off your first or next photo shoot. Now, I don't know if I've said this before, but Little Memories JA is actually located in Montego Bay. We have a studio here. So we do capture newborns, birthdays, just about any milestone. Now, Auntie Vers, one last question for you. What would you say is a mom hack that you can share with moms? Now, you've been a mother, grandmother, everybody mother, basically. What is one mom hack you would share? It's basically something that it's like a little shortcut or something that can really help in achieving something that maybe not a lot of people know about.
You don't only need to love your own children. You need to love other people's children. And we know there are mothers who just focus on their children. And your children are watching you. They are emulating you.
Yeah.
Because for my children, I have been kind. For example, whenever it's summer, I would take my leave. And sometimes they are quarreling. Why you want to leave every summer? I want to stay with my kids. And staying with my kids is to take care of them. So what happened? There are other kids in the community whose parents gone to work, so they come over to my house. And I put on the game for them to watch. And when I look, I saw so many heads. So I would go in the kitchen and put on a pot and cook for them so they can eat. And I am happy in that way I'm able to protect my child also and other people's children from what's happening outside, what they would be engaged in, the negative things. You know, so that is an example. That's one of the things I want to share. Love your children. Not only your children, but love other people's children. And whatever you do in life, remember your children are watching you. Be kind. You know, I've seen people today that the children have nothing. Woman is sick and the daughter did nothing for her. A stranger.
Yeah.
I don't know how she grew them. But you have to express yourself in that kind of love, kindness, and most of all, never forget that you alone cannot raise your children. You have to ask the God of heaven who gave them to you to help you. You cannot protect them. You cannot do much for them. You can only bathe them, feed them, give them a place to live. But where their protection and their health is concerned, I would advise you, always pray for your children. You know, Whitney, I had a thing on the door of my children from they were small. Until it was printed and it get brown. I can do all things through Christ who strengthens me.
Yeah.
And those children grew with that. And I would always be praying for them and with them. That when I went to management school in Kingston, and when it was so tough, because I went when I was older, when my brain going to sleep, and when I look, I could hardly manage. It was so rough. And I pack up and say, I'm leaving, I'm going home. And I called them and I said, come for me. I cannot manage this course anymore. And you know what they said? Mommy, you gave us a motto. From we were small. I can do all things through Christ. Mommy, you are going to do it. Because we went to university. We did it. You told us we can. You're going to do it. We're not coming for you. And trust me, I had to go back to the class and apologize to the lecturers and everybody and continue my course and hold on to that motto that I gave them. And I finished in fine style.
Awesome.
So never forget that with Christ in your home, you can do all things.
Amen.
Amen.
I don't even think we need to say one more word. But thank you so much, Auntie Vern. This was a very good episode. I'm just hoping that a lot of moms would have learned, so much from this episode. And, we want to say thanks for the wisdom, thanks for the knowledge, thanks for being a good grandma as well, and thanks for your service to your children and to other children in Montego Bay in Jamaica. Overall. We appreciate you.
That's why I'm called Auntie Vern.
Yes.
Even by the very adults.
Yes.
It's Auntie Vern.
Yes. So thank you so much, listeners and viewers, for viewing another episode of the Memories and Motherhood podcast. We hope it was a good one. Remember to like, subscribe, share this episode with a mom friend, and also leave us a comment or a review in the review section. See you for the next episode. Bye.